What is up, everyone? Welcome back or to my channel. For the ones who don't know me, my name is Shweta. I am the founder of Healthy Dynamics. We are a coaching practice that helps healthcare professionals from non-English speaking backgrounds improve both their language and communication skills in order to become better communicators, achieve language fluency, workplace excellence, and moreover, build positive relationships with their patients and colleagues that is based on trust and credibility. So I have decided to now start a monthly video interview series where I'll be interviewing experts in the field of healthcare, communication, leadership, just to broaden the scope of what this channel and my brand is all about. So I'm someone who obviously claims to not be an expert and will never be one either. And it's always a good thing to do this in a collaborative fashion when you know that there are people who have been doing their jobs and their roles, have been very good at their crafts for a very long time. So this is going to be a monthly video interview series for the rest of the year. And this month's interview has been already completed and recorded. So I'm going to I will be introducing this month's guest. Her name is Trisha Choi. So this interview that I'm going to be playing on next will be all about her experience in the patient services field, how she has contributed to it, what she has learned from it, and how she's now helping clinicals and healthcare facilities in North Carolina and the rest of USA move forward and improve their patient service and healthcare standards. So make sure that you watch the interview and hope you enjoy it. And if you do like what the content is on this channel, please make sure that you hit the subscribe button and notification bell, as well as leave it a like if you like the elements and contents of this video. So over now to Trisha's interview with myself. So welcome everyone, the audience of Healthy Dynamics. This is the first interview of a monthly interview series that I will be doing with industry experts in the healthcare field who have worked closely with patients and who can contribute a lot in the space to communication skills and any skills that we can use as healthcare professionals in order to do better at our jobs and also build good relationships with our patients. And my first guest in the series is Trisha Choi, who has had a lot of experience in the patient service field in the USA. She is from North Carolina, so I'm going to let her introduce herself. So hi, Trisha. Welcome to our video series. It's great to have you on.
Thank you for having me, Shweta. I have been working in the healthcare space for about 30 years. Before that, I worked in public relations and marketing and celebrity assisting. So I really know what it is to treat patients as they should be as a VIP. And I have recently enjoyed working with a major academic medical center here in North Carolina. I was in between working for a community hospital here in North Carolina and then for 18 years at a New York City academic medical center. And the great thing about that organization is they were two major medical schools that combined, and they are one of the only successful mergers that I know of worldwide in the past several decades. So it's been a great learning experience for me over the past decades.
Yeah, definitely. Yeah, your experience not only sounds valuable, but also very extensive in many ways. So I just have a few questions for us to, I'd like to know a little bit about your journey and your contributions in this space. So I know that you mentioned, as per your LinkedIn bio, that you work in the field of patient service. Now, this sounds like a really loaded and somewhat of a fluid word. Now, so I just want to get a little bit of clarity on what your definition is of the term patient service, and what is the technical definition, and how has that evolved over time?
Okay, so for me, patient service, as you had put it, is being with others while in service to them. So before I even started working as in public relations or a celebrity assistant or even in healthcare, I worked at New York City restaurants as a hostess and a waitress. So I was also working in a daycare center while I was in college. It means to patiently serve, or even in my job when I was 15 as a receptionist at a dental assistant's office, it's how you serve patients patiently.
No, I like the
And
one that you've included patiently. Yeah, yeah. They say that a lot of doctors, or not just doctors, healthcare professionals don't have any patience with their patients. That's a
yeah,
little bit of a tongue twister, but I really like the way that you put it. But yeah, just going back to the second part of our question, what? So that's your definition, which perfectly makes sense. But in the bigger world, the technical definition, how is it known as, and how has this evolved over time?
yeah. So since I've been in the industry, in the sector of healthcare of patient experience for several years now, it has evolved from really listening to the patient's experience and making sure that it is an excellent one. So how can we continually improve to make their experience better? So different organizations make sure that they listen to patients through focus groups or through surveying. So how do we continually listen to what our customers or patients and families are saying so that we can do a better job? And it's really making sure that the patient is at the center of the care.
100%. 100%. And has the definition evolved for you personally or in the industry itself over time?
Yeah, I think it's patient experience or patient services or patient excellence is about delivering excellence and trying to attain that consistently for my customers, patients, and their families, and also the community.
Okay.
And it's making sure, I think, like you said in the beginning, that there is open conversation and open communication consistently. So if they're unhappy with an aspect of their care, that we know that because we're inviting open dialogue. And if they are happy about their service, that we too have avenues for them to share so that we can grow. And I think you might know that in the United States, the government has taken a very serious interest in how highly we perform for our patients. And so there are government standards that we have to adhere to in order to continue to exist as hospitals. So I think you might know in the last 3 or 4 years, many hospitals have shut down. And it's because they haven't been able to uphold that standard of care that the government holds us to. So they're called HCAHPS and for inpatient hospitals. And there's soon going to be emergency department caps. I think we just learned in January that there's now ambulatory surgery caps. So they're assessments that we have to go through to make sure that we're attaining a certain level and score.
Very, very interesting and very fascinating. I can tell that it's a very complex and in-depth area. It's not just, you just do the patient, you just do a good job for your patient and that's it, and it's a one and done. It's something that there's a lot of scrutiny, there's a lot of standards that you have to adhere to and performance indicators. I know that KPI is big, but this is just a different aspect of that. So that was
right.
fascinating. Yeah.
And
Now,
we have to make sure also that we're being held against the standards of other hospitals across the country. So there's
yeah.
definitely benchmarks that we have to reach and consistently aspire to.
Of course, yeah. Now, what actually got you interested in this field? I know that in the as per what I saw when I saw your bio on LinkedIn, that's how we connected. You had an experience as a patient with a nurse in the past, but can you think of any other cumulative events in your professional or personal life that got you interested in actually pursuing a career in this?
Sure. So here also in the States, in high school, I was required to do some volunteer experience. So I chose to do that volunteer experience in a nursing home. And as I mentioned before, I worked at a daycare center. I was really drawn to the caring aspect of human to human connection in the healthcare system. So in hospitals. So yes, aside from having a personal experience, which inspired me to do better and teach how to connect with patients, I was a patient who experienced transformative growth and change and discovery within the walls of a hospital since the age of 19. I found every single job interesting, including the recreation therapist, the occupational therapist, the phlebotomist who took my blood, but specifically even the environmental services worker who cleaned my room and made sure that I was safe and that the quality of care that I was getting was utmost. So together, the team created a healing environment and a place of wonder and to wonder. So not to wander, because I was a patient, as I have shared openly, in a lockdown psychiatric unit. So I couldn't wander. And
Of
so,
course.
but it was important that the space was safe and the space was clean and that it also was healing on all those levels. So that's how I kind of, at the age of 19, got exposed. And then I thought, I think I could do this. And when I finished my undergrad, it was in health education. I thought I was going to be an occupational therapist, and it just didn't turn out that that's what I was actually able to do. It requires a lot of patience to watch a patient move their hand that's healing from here to here, and it's like a lot of steps in between, and I just didn't find that I could apply myself in that way.
Mm-hmm. Now, would you mind sharing, if it's not too triggering for you, if it's not too upsetting for you, the experience that you had with that nurse who communicated with you when you were an inpatient in a psych ward? And
Sure.
that was a very, from our conversation, that was a very pivotal moment for you. And that was a big turning point for you that, I suppose, motivated you to do better in this particular field. So do you mind sharing that?
Not at all. So it wasn't my first hospitalization. It was later on. I believe it was one of the times that I was trying to make sure that my medication was as low as possible so that if I conceived, I was married at the time, that my child would not be exposed to unnecessary medication. So I was working in conjunction with my doctor, and at the time, perhaps maybe my medication levels were not appropriate. Um, it was in the unit of that hospital that I probably was badgering the nurse. So I was in the middle of psychosis, acute psychosis, and I probably wanted a crayon. And I probably kept saying, "Hey, can I have a crayon? Can I have a crayon? Do you think I could get that crayon?" And I don't know how many times I might have asked her for this item, but she turned around and she said to me, "I swear to God, Trisha, if you don't just have bipolar disorder, you probably have borderline personality disorder, PTSD, and some other whole host of psychiatric diagnoses. Leave me alone." And the way that she said it, it wasn't specifically the words that she said, but it was really the anger, the frustration, the lack of patience that she had with me that really hurt my psyche, because I was in acute psychosis at that time. I wasn't well. And I wrote a letter to her boss, to the president of the hospital, and said, "This woman should not be working as a nurse, or she needs a leave of absence because she really hurt me." And interestingly enough, I ended up working at that hospital for almost 20 years. And I had the opportunity within a 10 years time to sit in front of her to teach what you do when you have a bad day. And I don't know if she recognized me. It didn't matter. It just was an opportunity for me to humbly lead and sit and say, we all have bad days, but we also have to be responsible for how we take care of ourselves so that we don't end up hurting somebody.
Yeah. And something that I do, and I'm not the only one, plenty of people in the healthcare space, they really now are advocating for healthcare professionals to really prioritize self-care, not just for them to show up in other areas of their life, but in particular to show up for and provide the best care for the most vulnerable members of society. So I'm very glad that you were actually able to see things from her perspective. And obviously it doesn't condone what she said or did to you, but hopefully, she was able to take it on board and move forward with the tools and strategies that you had provided her. And I actually did also have a very similar experience, not as drastic as what you came up with,
I was also in inpatient at a psych ward. You're talking about 6 or 7 years ago, or 8 years ago, and yeah, I had a therapist who was somewhat of a very similar sort of nature, although she didn't go to the extreme of putting labels on me as a patient per se. But yeah, she was very condescending. She was very, she would jump to conclusions and say, and I did the same thing. I left feedback, and this was because it was a private hospital. They took it very seriously because you're obviously paying them, and then when I went back again, this was a few years after, I saw her again, and she had done a complete 360. So, and I was actually pretty scared, like, oh my God, it's going to be her again. This is going to be the same thing. No, it turns out that she had done a 360, and I was pretty happy. This time I didn't have it. Yeah.
Yeah, I'm sorry that that happened to you. And I'm not sorry that it happened to me because it inspired me to get into the work that I did. And I think,
of course, yeah,
human beings are human beings, and we saw it especially time and again in the middle of the pandemic, and we're still in the middle of this, and people are tired. So you're right, totally. It does push us to really take care of ourselves first so that we can take care of others.
Totally, yes. Now, how has in all your roles in the patient services field, how have they managed to come up with the current framework of evaluating or assessing patient experience? And what role does that play in assessing your colleagues and team members' performance?
So to date, I have worked for 3 healthcare organizations. 2 are academic medical centers, and 1 is a community hospital, as I mentioned. And my dogs are very excited about this, as you can hear. I'm sorry if they're barking. But so at my New York hospital, which is where the 2 academic medical centers merged and medical schools merged, we had our own framework, and then at one point hired an outside consultant from a top performing hospital in the United States, which is Cleveland Clinic. And then together with our hospital and the patient experience team, we developed training, and then we trained our managers first, and then we trained them to do train the trainer on the curriculum. And then shortly after, there was a chief experience officer role that emerged in our country. And the chief experience officer came from another major top tiered hospital in the country. And he decided that whatever we were working on needed to be redone within maybe only a 2-year period. And what he then did was create a credo. And he said he consulted with leaders and staff within the hospital and then inculcated it into the training. So we had something that occurred every single Friday. We called it Patient Safety Fridays. And that was integrated into the fabric of behavioral change with our change management, human resources, and it also lived in our evaluations, which were held twice annually. At the community hospital I was at, they had a very well-developed learning opportunity. So they had classes which staff could self-assign, and then leaders could also assign their staff to come to these classes. And there it was very built into, again, the annual evaluation of all staff members. And they made it fun. So the community hospital, I don't know, for some reason was a lot lighter, and it was just, for me, a lot more woven into our daily existence. And then this last organization I worked at, which is an academic medical center, I was the leader of patient experience at the main hospital. And I got to bring in what I learned from the 2 prior organizations and really went back, because it was in the middle of the pandemic, to simple bite-sized learning. And I didn't do it by myself. I made sure that my patient experience team created it alongside of me, and then we vetted it by all of our 100 staff members in patient experience. Once they actually gave their, check of approval, we then started training this, we called it cultivating kindness, and taught it an ambulatory clinic to see how it worked. After that worked several times, we then took it to our valet team and made sure that the people who are greeting our patients and parking their cars adopted this cultivating kindness behavior. And then we then brought it to our inpatient team and so on and so on. So I know that at that organization, they recently hired a culture company who's going to be able to help set behavioral standards. And it's going to be recreating the entire training, I believe, and making it a lot more flushed out. But it really is about making sure it's with every person every time that we are cultivating kindness, and also that it's part of an annual evaluation process for our team members, or else how else can we make sure that it's something that we're living?
Excellent. Yeah, a lot to take in there for sure. Okay, and I'm very glad that there are systems and everything put in place, and it's much more deep than just you're just doing just a one-off, or you're just ticking boxes for the heck of it. So yeah. Now, what are the different ways in which these organizations gets feedback from patients on their experience and the service that they received, and how frequently does this happen?
Okay, so most organizations have surveying of some sort, and they either use a major player in our organization, in our healthcare system, is a company called Press Ganey Forsta. There's also an organization called NRC, but these companies will handle the surveying for you. And so they'll look at all of your disparate teams that you provide care in throughout the hospital. So inpatient, maternity, our emergency, and our ambulatory surgery, and they'll develop specific questions for each of those areas. And so some hospitals even will take this task on internally and create their own surveying. Another way is to have patient family advisory councils. So council members that will advise us on, hey, there's things that I've experienced as a patient in this organization that is excellent, continue it, or this needs to change. Can you help make that change? We also have boards at every single hospital across the country. So how does our board advise us on what needs to be done based on what they're seeing and experiencing? I, at my last organization, was in charge of the grievance department. So there are people who are receiving complaints, grievances, and even accolades. And that's another way that we get feedback from our patients. One of the best things that I loved, and the biggest part of my role at most of my organizations, was rounding with patients. So making sure that I, as a leader, and senior leaders above me were rounding with me, not just on staff to ask them how your experience is going, because they are the ones that are providing the experience, but also with patients and going into patients' room and saying, would it be okay if I sat with you for a while? Can you tell me about what we're doing well? How's the food? And then maybe could you tell me one thing that we could improve on? And some organizations will actually hire companies that have a rounding tool. So my New York organization did it pretty much on their own. And then other organizations have hired out vendors. And then I think most organizations also have listening circles or focus groups. But the more advanced ones that are higher performing organizations or high reliability organizations have employed lean tactics. I'm not sure if you're familiar with that, but how to reduce waste within our healthcare organizations, and have tier 1, 2, 3, and 4 daily huddles. So on the first level, we're talking about what went wrong during our shift. The second level, how we could improve things. And then the third level is with leadership team. And then there's a senior leadership team if something needs to be raised to that level. But it's a really great way of listening to how we could do better for our patients and how we can celebrate our staff when they did well.
100%. And I think I really like the fact that, surveys do serve a purpose, don't get me wrong, but it's nothing like actually doing like a video testimonial or just getting it straight from the horse's mouth, as they say. If when a patient is in the thick of things. Now, obviously, some of them, they may not be able to provide that feedback instantly because they may be vulnerable, they may be very unwell. But at some point, getting it off them, or even their family members, if they are not able to advocate for themselves, or even if they have next of kin or a family member, it's a really great thing that that way you can experience firsthand, what you can improve and what has been going well. Now, how have all these feedback systems improved the service levels in hospitals and healthcare providers?
I would also say it depends on the organization because from my experience, the larger the organization, maybe the slower it is to change. There's definitely room for improvement. Technology helps, but it really is the regular practice of seeing where improvement is needed and where the most efficient use of time and energy is required and best served. So I think if we're taking that feedback and then using our partners like Press Ganey or NRC, and then helping them to analyze our data and then seeing what are the major themes that are coming back, rather than picking at every single comment that comes back on the survey, but what are our general themes and are we making changes in the area that we need to? So I heard recently when I was working at the last hospital that there are people who focus on the wrong things just because they're hearing that, parking is a problem for our patients. They decided to go ahead and spend several $1,000,000 to recreate the parking garage. But what really needed to just happen is that maybe there was a need to greet patients coming into the hospital differently and then walk them to their clinic appointment. Or maybe we needed a golf cart, or maybe you needed more volunteers to just walk people to their location. So I think that sometimes we could take the feedback and use it to make great changes, but we need to make sure we're making the right changes before too much money is spent.
Yeah. And doing things for the heck of it is, especially when money is involved, nothing good could come out of it, and you sort of end up losing a lot. I think the whole, how to take the feedback on, interpret it, has to be done in a more collaborative way, and you need to get perspectives from everyone in the field, and just sort of see what work out and decide what's the best way to move forward. And just to conclude, in what areas do you believe is there a room for improvement in the patient service space? I know it's a loaded question, but I just want to get from your perspective what there can be improved on.
Like I said, I think we live in a world today where technology can really help us if we're leveraging it correctly so that we can be freed to do the things the computers cannot do. For instance, really and truly connecting human to human and then feeling all sides. So sort of like a diamond, right? There's so many facets. And then I also think that we have the opportunity to use external consultants and likely have the best opportunity. They have the best opportunity to see things at a 3,000-foot level and are able to see what's needed from the outside. I think also they can work together with internal teams and leadership and make sure that they're making change that is sustainable and that is going to last for long. So, at my New York hospital, they had me work at the lowest scoring hospital because they all reported up until one government CMS number. I went there and it took 6 years to change scores, but they were the lowest and they became the highest scoring hospital in 6 years. What that entailed is making sure that the leadership in that small 200-bed hospital and I were speaking the same language, and it took time. How do we get all of the managers, nurse leaders to speak the same language? This leader was a finance guy, and he liked pivot tables. So I had to learn to adopt to his language And then our overall leader really liked to think in terms of stars and how did we calculate our stars. So it's making sure as a patient experience consultant that you're working both with all the leaders. And I guess finally, it takes a special person to be in patient experience because you have to be really skilled at so many different areas. I also think there's a lot more that a patient experience leader can do outside of the role. They're speakers, we're coaches, we're teachers, we're influencers. We have to be technologically savvy. We have to be business minded. We need to know how to save money. And we need to really know how to work with people, manage people, volunteers even.
Yes, yeah. And I think in a team, I really like the fact that everyone brings something different. And I think that's how it makes a very good team. So everyone has a different perspective. One person is a big picture person, one person is a more detailed oriented, and coming together that way to deliver a seamless experience is very, very impressive. Well, Trisha, this has been a very interesting and I've learned so much in this, in our little chat, and definitely there's so much room for improvement, and I'm very grateful for the work and the contribution that you have made to the space. Now, would you like to tell our viewers where they can find you?
Currently, I am a free agent, so you can find me on LinkedIn. Just look under Trisha, Trisha Choi, Choi. I started an LLC called Try Joy. People think when I say my last name Choi that it's joy. So I think I really also have learned in this time of working and exploring on my own that joy is really something we need to spread. So
of course, 100%, yeah.
Stay tuned. I'm not sure what's going to be coming from that. I really believe in wellness. I also believe that it has taken me at this point 50 plus years to learn how to really take care of myself and be, as I like to call it, mental wellness. And so I like to share that with people and help them cut down on the time that it would take them to learn what I learned. So young people today know that even if you had experiences like myself and you, there's a great future in sight. Just, hang on. I think there's a lot of tough times that we're living through right now, but you too can be an assistant vice president of patient experience or a president of a hospital or owner of your own company. So
yeah, 100%. And yeah, becoming better communicators is something that we all need to do. But I believe that in a space like this, when you're working with the most vulnerable members of society, it's very, very crucial. And just to finish off, actually last night, my partner, he's been having chest pain, quite a severe one for the past couple of days. We actually had to get paramedics to come into the house. And that actually gave me a really good introduction of what paramedics, how they communicate with patients and how they make them feel, how they get information. So I was very impressed. And also I have a lot of respect for what they do, and then he had to go to the emergency room. I couldn't be there with him, but just so that, and he's back home now, so that's all good. But yeah, it's just interesting that this happened literally less than 24 hours before.
Oh, no.
So yeah.
I hope he's okay.
Yeah, he's okay. He's just at home now. He's just going to be at home for the next few days, just resting up, and that's what they've ordered. So it just turned out to be, just chest pain.
Timely.
Yeah, something like that. Now, it wasn't we suspected that it may have been a heart attack or an embolism. It didn't get that far. But yeah, I was very impressed by how the paramedics were actually communicating with him, and how they were getting information and how they were making him feel, how they were reassuring him, and how they were getting me involved in the process as well, and getting me to be like his representative. So yeah, and that again gave me a very good insight into how they communicate. So again, that definitely is I'd love to interview a paramedic, I think, on the channel.
Oh, you reminded me, because when I was working at the community hospital, my role was to work in emergency rooms. And I would tell everybody the ones to watch are those paramedics, because you know why? When they're out in the field and they're working on someone on the street corner, they have to immediately get the trust of the patient, and they have to establish eye contact, and they have to say reassuringly, I'm here for you.
Oh, yeah.
I'm here to my voice. You were just in a car accident, but I'm here for you. Or you just had this really scary thing. I'm at your home. Don't worry. I'm here with your partner. As if you could, we call it narrating or externalizing or talking through your steps. If you're a dentist, if you're a doctor, if you can do that, then you're gaining the trust of your patients and the family, and that's so important. And I'm doing a choose your own journal, it's called, and it's helping me to find my purpose. And the exercise last night, the prompt was journal about a place you would like to volunteer for a day. And I thought really long and hard about it. And I said, if I could work just for a day with special needs individuals, I'd love to, because it would really teach me about life. Because it would, right, teach me to connect and try to gain trust, and then at the same time have fun. We have a restaurant here in Greensboro, North Carolina, that is 100% staffed by special needs individuals.
Oh, wow.
I would love to do that, but you're right. It's paramedics and also the connection with special needs individuals that have that special way.
Yeah, and also anyone who works in the front line, the thick of things in the emergency space is it's a different skill altogether. And I think they master how to build trust, because they have to do it on the spot instantly in the most sometimes very catastrophic situations.
I'm so glad that your experience was a good one, and that your outcome is a good one with your partner.
100%. Anyway, Trisha, thank you so much for your time today, and I look forward to having you on in the future at some time. So, and everyone, thank you so much for your attention and for watching. Make sure that you hit the subscribe button and the notification bell for more videos, and not just the monthly interview series, but also weekly videos on the different topics that we'll be covering in the healthcare space for improving your communication skills. And also, if you like the video, please hit the like button as well and share it to whoever you might think it would be beneficial for. So until next week and next time, or next month in the interview series, this is Shweta and Trisha signing off. And thank you for your attention, and have a lovely day. So much.
Good evening.